67, 68, or whatever my qualified age is that I'm going to retire, get full retirement benefits on Social Security and go to Medicare, I want to get off the group. So if I want to get off that employer plan, when you go apply for Medicare, they're going to go ahead. Medicare does this weird thing. They will go ahead and retroactive your Part A effective date 6 months. Okay. So what's that do for you if you fully contributed your HSA? Kind of puts you in a little IRS situation, right? Well, I've had some people say, what do you mean? Nobody told me that. I know. It's happened to some folks. And what I suggest is call your financial institution. They would generally let you take that money out with no issues for their client, for your clients. Okay. So that's one thing that I would recommend doing. So when somebody calls me and they say, Al, I want to retire when I'm 68. And I'm always asking them, do you have an HSA? All right, make sure we don't fully contribute to that HSA for those past 6 months. Okay. So that just keeps you out of hot water and not have to extra work. Correct. Now, whatever you put in there is fine, except for that last 6 months. Now, if I was only putting $100 a month and I can put, say, $3,700 in there, you're fine, right? Because it takes it by, let's say it's a $3,700 contribution you can put in, or if you're over 55, it can be an extra $1,000. So you break out that $4,700 divided by 12, and really you can make sure that you have that amount. So I fully do what you can, but make sure that you don't overdo it. Okay. Any other questions? Okay. Next question. Rules for an active employee to delay Medicare. Is there a penalty for those above 65 and begin Medicare retroactively? So it depends if there's credible coverage. All right. So first of all, there's a lot of options out there. There's people not working, or there's people working, self-employed, that have an individual plan, right? And if they have this individual plan, generally speaking, they're going to want to get Medicare right away when they're 65. Okay, it's called the initial election period. You have 3 months before, the month of, and 3 months after to get Medicare with no penalties, waiting periods. Okay. Then there's 2 other types of employers. Let's say there's an employer with more than 20 employees. If there's an employer with more than 20 employees, then the employer plan pays primary. So they pay first. So that means you do not need to take Medicare. You can hold off. Okay, that's when the HSA really works for some people. I'm like, that's the first question when they call me. Your employer more or less than 20 employees. More than 20 employees, do you have an HSA plan? Because if they have an HSA plan, it's like, don't apply for Part A. Because Medicare Part A is generally no charge if you work 10 years and paid FICA taxes. So if you're over 20 employees and you want to still contribute to that HSA till your full retirement age of when you want to retire, I'd say don't apply for Part A. Okay, keep funding that money. Okay, because we get to take that money with us. That money can pay for medical bills. It can pay for Medicare Part B premiums. And one of my clients had like over $30,000 in her HSA, and it's just helping her pay for her premiums. So it works out really well for her. But the other thing is, well, I'm employed. I work for a company. My company insurance should be covered. Then I ask, how many employees is it? How many employees we got? 2. All right, we got 2. We're getting close to that 20. No, so in our case, when we turn 65, Medicare is now primary. Okay, so that means we have to apply for Medicare. Do we still want to stay on the group? Generally not, because the prices don't go down because Medicare is primary. They used to before the Affordable Care Act, but we want to just get that person off the group, right? Because there's going to be more affordable options at that time, and at that point we'd want to stop our HSA contributions. Okay, so is there a penalty for those 65 and begin Medicare retroactively? So did that answer the question? Think so? All right. So in this option here, I'm over 65 and ready to retire. There's a special enrollment period. All right. This would be somebody that is coming off of a group plan, and needs to get insurance, whether they have an HSA or not, whether they have Part A or not already. There's going to be some options that you get to do with having a special enrollment period to avoid penalties and avoid waiting periods. Okay, people always say, you gotta, if you're turning 65, you're probably going to get a ton of calls. Joe Namath's going to want to talk to you, right? You've probably seen that commercial. They're going to say, you have to buy it. You have to take it. If you don't, you're going to get penalized. You're going to have these problems later in life. Well, it's not true if you have the correct coverage. So if you're on that group health plan with more than 20 employees, that we know the employer plan pays first. So when I want to retire, you generally call your Medicare specialist and then you ask them, what do I do? First thing you do, if you don't have Part A, you have to go to ssa.gov and apply for Medicare Part A. Okay. And then what I do after that is once I have that Part A, I have these two forms that I have to fill out. Okay. There's a 40B form and an L564 form. The 40B form is requesting to have Medicare Part B, and the L564 form is the employer form that makes the employer complete and says, oh, this person had credible coverage. Okay. That gets you off the hook for any penalties and waiting periods. Okay. So that's what that is. And another thing is, let's say if I come off of a group and I want to be able to get Medicare, I do have a window. I believe there's a 8-month window there that you can, during that 8-month window, you won't get penalized for getting Part B. Okay. Now, let's see if this next, there's the 8 months. I was wondering where that was at. This little clicker is great. All right. So you would have from the time that you did not have coverage, if for 7 more months after that, you would have the opportunity to get Part B, no charge, but without any penalties. Okay. All right. So discuss how you can appeal the IRMA charge for specific life-changing events. Does anybody know what IRMA stands for? Never get rid of it. Well, all right. We'll see about that one. You do know what it is. I hope all you guys know what it is. If not, I'm going to teach you guys what it is, because it's probably pretty important for your clientele, wouldn't you think? We hope your clients have a little bit more money than some of the other folks, right? IRMA stands for Income-Related Medicare Adjustment Amount, okay? If anybody would have got that, I would have given you a prize. Probably a pen or a ladder opener, something fun. I forgot the backpacks. So, with the IRMA, how that works. So if you're going to see this chart every year, it changes every year. Okay. We do not have 2024 information yet. I'm assuming it'll come out next month. Okay. But I have this little chart for you. And it shows that if you're an individual making less than $97,000, now this is modified adjusted gross income. Or if you're filed jointly, it's $194,000. Okay. So, and they're going to look at your taxes from 2 years ago. Okay, so you're like, wait, I sold a house. I sold my business. I took out a bunch of money. You, as advisors, might want to know this to advise them on how much money they need to take out. Or maybe they're turning 70 and a half. Is that a magic number for you guys? Is it still a number? Is it still 70 and a half? Is it 72? See, I had my license to sell investments years ago, and I thought it was crazy, so I got out of it as fast as I could. But I did know that 70 and a half, you got to start taking some money out, right? Or you might have changed it. I don't know the rules. That's on you, not me. I'm the Medicare guru, not that. I always say, talk to your financial planner. Not for me, man. I can't do that. All right. So at that point, they're going to go back and look at those things. Those tax returns. You're going to get that form from Medicare. They're going to say, oh, you owe us $164.90, right? And then a day later or 2 days later, he's like, hey, you're a winner. You qualify for IRMA. What a great qualification. And at that point, they're going to send you a letter and say, oh yeah, you made over $500,000. Now your adjusted premium for Part B is $560 a month. Okay. So that's the additional. So if you look at the bottom there, that's additional to the 164. Yep. That's additional per person. per month. Yes. Okay. So this is the Part B, as in boy, the medical side, income related Medicare adjustment amount that your client gets to pay. Okay. Now, and just to show you on this next slide is not only do I get to pay that higher premium on my Part B, but when I go on Medicare, what else do I need to get besides Medicare A and B? D, which is drugs. Okay. So when I go buy a drug plan, you're going to get another great letter saying you're a winner. You get to go ahead and pay an extra $76 on top of that $560 before, and then you get to pay for your Medicare Part D premium. Okay, then you get to pay co-pays for your drugs, probably a deductible and co-insurance. Okay, so it can be kind of costly when talking to someone, and if that person is an employer, let's say he's over 20 employees and he wants to retire, he's like, man, if I get off this group plan, maybe we can lower the average age and we can lower our costs for the group health insurance. And then they talk to me and I'm like, well, you're out of pockets over $600 right away. And I don't know if you can have the employer pay that, right, and write that off. So sometimes it might be worth keeping that employer on that group health plan. That makes sense? Until you can figure out a way to make that money go down. Okay. Now we know the employer doesn't want to make that money go down. He wants to make that money go up, and he wants to continue to use that in his retirement. So he may be lucky enough to be able to have to pay that premium at that time. Okay. So with that being said, there are ways. So let's say I sold that business. I sold my houses, right? And I had a great year. But today I'm living off $80,000 adjusted gross income. Was there a change, life event? Probably, right? So what we do is we try to advise them, or let's say there's a death of a spouse, there's a marriage, divorce, loss of coverage, all these different options here, loss of pension. You can ask for a reconsideration. Okay. I just happened to me yesterday. This gal's getting divorced. She was at my house and she's like, well, Alan, I'm at that $500,000 rate, right? And she said, I don't know what I'm going to do. I'm not going to make that money. I printed off two forms for her, the SSA 44 form, and I think it's the 561 form, which is the reconsideration forms. And I said, what's your 21 taxes look like? And so, well, they don't look like that. So I said, well, take your 2021 taxes with these two forms, take it, walk into that office. I know people are like, I don't want to go in there, right? I'll wait 2 hours. We'll get there at 8:30. It opens at 9. You'll probably be out of there by 10. If you show up at 9:15, you'll be out of there by noon, right? I've seen those lines happen before. But you go in and you talk to those nice people, because they're all nice at the Social Security office, right? You go in and talk to these folks, and don't be mean, and probably take some donuts or take something nice to help them, help you, smile, and ask them for help. And most likely you'll get the help you need. They'll help you fill out the forms. They'll take all that information, make copies, submit it, and they'll find out where your level is going to be at up here. Yes. Great question. So the question for the people in there, hi, is when should I send this in this reconsideration form, correct? Okay. So whenever I get that letter, and it's usually like 10 days before my effective date, right? You've been waiting for it for months, but it comes in and like, you got to pay it in 3 days, that's usually what it says. But I tell, and it tells you on the letter, like you have 60 days to do it. Okay, so don't wait. You want to go in and say, I'm not making this money anymore. because I don't want to pay $500, $600 till the end of the year when it's February, right? So you want to get that in their hands right away. So I always tell them, when you get that letter, you go in right away. Okay. Yes, ma'am. Okay. Mm-hmm. Mm-hmm. Correct. You can do that. You can wait. I don't advise that. I wouldn't advise that at all. Well, here's my experience. And, anytime you deal with SSA, the experience is different every time. Okay. So bear with me on that. All right. I would personally have that person take those forms in right away if there was a mistake or if there was changes. And if they that's up to them to make that decision. Now I'll tell people, take these forms in. Will you help me fill them out? I was like, I'll help you fill them out. I'll help them fill it out. They go in. I don't want to wait in line. I want to put them in that drop box. What do you think happens to that drop box? Who's going to touch that? And when will they touch that? I've had people put in their Part B forms because they don't want to wait. And the nice gardener's like, well, there's a drop off right here. You don't have to wait. Well, they're still waiting for their Part B. And their effective date was supposed to be September 1st, right? And they handed it in July. So don't advise that. Advise them to take that hour, sit down with that person, fill that form out, and let them enter it. Because some of those people are so nice, they'll just say, I'll get it done later. Okay, I'll do it today, I promise. Don't do that. Have them stamp it. Say, well, I really need you to do it today. Can we do it? Usually they'll take care of it if you're nice and kind with a smile. So I'd recommend going and putting it in. Usually that determination is right away. Sometimes it can be right away, or sometimes it can take up to 30 days and get adjusted. What the government asks you to do is pay the amount, right? Pay the amount, we'll reimburse you. Well, nobody likes that, right? Especially when you don't have that. So that's why I like to talk to the person, and then they'll say, well, just put in the 164, maybe you're on the third line down, just send that amount and we'll adjust it and credit it. One thing they won't do is cancel your insurance because you paid something. Make sense? Okay. But that's what I would do. Did you have a question? Yeah. So let's say I made $600,000 or whatever, and I'm going to continue to make that. They're going to continue to look 2 years back. Okay. But if I said that was a one-off, I don't do that. And here's what I have. They'll just drop it. They'll generally drop it and make you pay what you're making today, if you can show what you're making today. Well, okay. You could, well, this year you sold it, 2023, you'll see it in 25. 2025, you'll get the letter saying, congratulations, you win. Okay. Good luck. But at that point, that's when you're going to want to send in the reconsideration letters and hand those in. Okay. But they will go back 2 years. All right. Yeah. For that year, if they say, sorry, we still see your income is higher, you're going to end up still paying that amount until they can see that it's adjusted down. Okay. Now, sometimes people are like, well, I don't agree. That's baloney, right? I want to appeal this thing. Okay, so there's 4 levels of appeal. You can request it. Your request is, if it's denied, you can go to the IRMA decision. You can first of all, we'll go to the OMHA, the Office of Medicare Hearings and Appeals, within 60 days of that reconsideration denial. And then if that's appealed, you can go to the Medicare Appeals Council within 60 days of that denial. And then if that's still denied, you can actually go to the Part B, enrollee can choose to go to the federal district court within 60 days. I've never seen anybody go that high. I don't think they want to waste their time at that time, but anyways, that's kind of how that works. So there are appeals processes to help that person get that rate down. Sound good? Was that a good one? That was right on for who? You guys, right? This is an important one for you guys. And so these numbers will change up top on the side there on the left. Last year it was 94,000. Again, I don't know what this next year is going to have, and I don't, but once we know, once I know, everybody else will know. So great. We good with that one? Any chats? Any questions in the chat? I can't. Right now, if there's you cannot contribute, no. So you don't have an option to put any money into an HSA or once you're on Medicare, okay? So modified adjusted gross income would be net, correct? Sound good? All right, I'm glad I asked. You can't have that many questions. We only have like 50 minutes.
I don't know if we're going to get to part 2.
I know.
Okay. So am I going to get hit by the first one? They're going to have to pay more time.
No. No. You will not pay more for your Medicare Part C than it's 0.
Because I'm actually paying that out.
That's Part B, right? Part B is different than Part C. You screwed my whole presentation up. I'm kidding. I'm totally kidding. We'll get to Part C. I promise. If we have time. I'm kidding. We should have plenty of time. Slowing it down. All right. We got a half hour. We're good. You can ask all I love the questions. You know, the guy that sits in the front row always wants to know, right? That's it. I like it. All right. Next question. What are the pitfalls if an employee chooses to stay on COBRA instead of signing up for Medicare? Anybody know if COBRA is deemed credible Medicare coverage or not? No. No, don't tell them, go ahead, stay on COBRA. They're going to pay you for 18 months on COBRA. They're going to pay for your COBRA. Who did that? One of my dentist offices did that. Okay. Now he's paying a 20% penalty for the rest of his life on his Part B. And he had to wait. Now he's paying a penalty on his prescription drug plan too, because that wasn't deemed credible because he lost COBRA. And he did it in July. So he had a bunch of months and he had to wait a whole year. So we had 12 months of that at a certain percentage, or an extra $5 there, but an extra, a lot more money on that Part B at 10%, right? $32 extra a month for the rest of his life. And if the Medicare Part B premium goes up, does it go up? Sometimes. Then your penalty goes up too. Okay. So I would never advise that. Okay. And if you did, shame on you. I've had some agents that have, and shame on them, but they don't do it anymore. Okay. COBRA is not considered credible employment and does not extend your Part B special enrollment period. Now, we said you might be able to take COBRA for how many months after you lose your job? 8? Was that you? It was 8. 18 is COBRA if I'm under 65, right? But if I want Medicare Part B, what was the rule back? I think it was a couple slides back. It was 8 months, right? Once I lose my coverage, I have 8 months to get that, okay? So COBRA and some retiree benefits provide credible prescription drugs, Part D. You may not need to purchase a Part D prescription drug while benefits are active. So most employer group health plans over 65 have credible prescription drug coverage. So that little penalty that they say, and the penalty for a Medicare Part D, if you do not have credible prescription drug coverage, my dad tried to tell me, I don't take prescriptions. I don't want to pay for this plan. You're crazy. I'm not going to spend $10 a month for this prescription plan. You know, I'm like, Dad, did you know there's a penalty? No, that's what your job is. I was like, wait, Dad, you got to buy it. He said, I don't want it. And so I gave him some scenarios and I said, Dad, if you don't do it, and it's July, and you get cancer, or you need a big, fat, ugly drug that is very expensive, and you don't have a $10 plan, we're going to spend a lot of your retirement, right? And you're not going to be happy because you can't buy it until January. And Dad, then you're going to have penalties on top of that for the rest of your life. And then he started cursing out the government, you know, went on and on and on. The farm guys like, rah, rah, rah. I was like, yeah, I know, Dad. Don't shoot the messenger. I'm just here trying to help. Don't hurt me. All right. So we got over that. And I'm gonna apologize for that third one because I spelled penalty wrong. You or me? All right. That was me. I'll say it was me. Even though I leaned to my right hand man. 10% penalty for those for every 12 months without credible coverage. So if you had that person that said they could get COBRA for 18 months, right? And their 18 months ends up canceling in, let's say, March or June, let's say June, right? So I've got 18 months already without credible coverage. When can I get coverage? January. I can apply in January to be effective the next month. So that's really technically over 2 years, right? So 10% for every 12 months. So now we're paying 20%. That make sense? For the rest of your life. Let's not do that. Let's fix that. Okay, my bad. Any other questions on that one? Well, good. And here's the scenario. If you did not elect Plan Part B at that time, and you're in this general enrollment period, that's when you can do it. Now, 2 years ago, you'd have to apply between January 1st and March 31st for July 1st effective date. As of 2023, if you apply, if you're in this situation, because you didn't listen to anybody or get advice from anybody, you would apply in January, it would be effective in February, okay? Main thing you need to know there is if you're following a general enrollment period, and I know all you guys like to sell supplements, Medicare Supplement Plan G possibly, or I might advise you to do that here in a couple minutes. I don't think there's a special enrollment period for GEPs, for general enrollment periods, to buy a prescription drug plan. So that person might be stuck with buying a Medicare Advantage plan, or they buy a supplement and go without a prescription drug plan till next year. And what's going to happen? Are they going to have penalties? Yes, they're going to have penalties. But did they get the supplement? Sure. They might. This has happened. I've been in business 28 years. I swear all this stuff has happened with my people. They call me, I need help. And you just got to tell them what the rules are. So just remember that, okay? All right. How do planners help the client determine which doctor they're seeing and if they can continue to use them on Medicare? How many people are insurance licensed in here can sell Medicare? You got a health insurance license? Yes. Health insurance license? Should you be advising people on their health insurance? Probably not, okay? However, you want to know the answer? I'll tell you. Depends if they're staying on original Medicare or electing a Medicare Advantage plan, okay? If they're going on original Medicare, there's a site called Medicare.gov. Anybody ever been on that? Yep, a couple people, all right? You can go on there and you can put their doctor in as of a couple years ago. You couldn't do that before. You can put it on there and they'll say whether that doctor's accepting Medicare or not. Great. What if you haven't seen that doctor in a while? What if you had never seen that doctor? Are you going to trust that the doctor still takes original Medicare? No, don't do that. All right. You call the doctor's office. Okay. You call the doctor's office. Say, do you still take original Medicare? Yes. Do you take new patients? No. You guys know that, right? I know that because I'm on the phone all the time trying to find new doctors. They don't want to take original Medicare. They don't get paid enough, right? The reimbursement's not there. The hassle of having to reapply because, hey, I did the same exact surgery last week and you accepted it. This week, you're not accepting it. Why? Because Medicare makes it easy for us, right? Easy, how that works. All right. So, did I do something wrong here? Did I punch the wrong button? I'm on it. Okay. I think I fixed it. I hit the side button. I don't know why. I just figured that out now. You didn't tell me that earlier. All right. Now, so that's if you have original Medicare and you buy a supplement with the standalone prescription drug plan. What if I have a Medicare Advantage plan? Right? Medicare Advantage plan. Anybody know what a Medicare Advantage plan is? We know you do. We know. You told us. All right. So Medicare Advantage plans are administered by private insurance companies. Who has insurance right now? Under 65. Under 65, anybody have insurance? Group insurance, individual insurance? You might have insurance, okay? If you have insurance, you probably have a network-based plan, right? HMO, PPO, POS. That's not what it stands for. Point of service, folks. Don't think I was saying anything differently. All right, so those are controlled plans, right? You have a network of plans, of doctors, right? You got to go to the doctor, you got to stay in the network, or you might pay more money, unless it's emergency or urgent care, correct? If I have a PPO, I go out of network, I pay a higher copay, higher out of pocket, and you might be subject to balance billing if the doctor doesn't want to take the rate that the insurance company wants to pay. So I'll just go to whatever insurance company you have. You probably have United Healthcare. Oh, geez. Don't get out the wallet. Oh, no. Humana. All right. So I don't advocate any, this is education. I don't care what company you have, but let's say you go to Humana and you go doc find. You put the doc find in and you see that doctor is in the network. Woohoo! I'll take him. Right? You call the doctor. You say, hey, I just signed up Medicare Advantage plan. You're my new doctor. We don't take new patients. We stopped taking Humana years ago. It's the doctor's responsibility to go in and change that with the carrier. It's not the carrier's responsibility to go change that because they can't call the doctor every month. You gonna take us? You gonna take us today? Right? So what do you do? Who do you call? Who do you call first? Besides Ghostbusters, they're next on the list. Call the doctor's office, okay? Make sure you call that doctor's office and ask them, you take Humana? Yeah. Do you take Humana, Medicare, HMO plus? What is that? No, we take Humana, employer group plan. What are you talking about? We don't take Medicare. So pull your card out and you tell them, do you take Humana, Medicare, HMO plus? Then they'll say, oh yeah, we take that one. Great. Then you can have that doctor. Okay. It's a lot of legwork for you guys, isn't it? Something you probably might want to stay out of, but you can advise them to call their what? Okay, good. All right, next question. All right, what resources can planners use with clients to compare Part D plans annually? Well, go to Medicare.gov. Okay, you can help them create an account and you can put in their drugs and you can put in their pharmacy and you can click find plans and it's going to find all their plans from cheapest to most expensive. Okay, because they're going to know what drug it is, the milligrams, how many take per day, and now you're going to tell them the pharmacy you go to, because not all pharmacies are made the same. Some preferred, some standard, right? To find Part D. You can do that for Medicare Part C too, those Medicare Advantage plans, because Part C combines A, B, and D, doctors, hospitals, and prescription drugs, all in one plan. Medicare pays those companies to insure you. They pay them about $950 a month, and they're off the hook for the 80% of the $1 million, okay? Plans change every year. New plans are available October 1st of every year. Now, be aware, next year, Inflation Recovery Act, or next year, you heard about that? What's that mean to you? Probably not good, right? What it means to me in Medicare in 2025 is right now, when it comes to Medicare, you ever heard of you pay a deductible, you pay co-pays, co-insurance until you reach a donut hole, coverage gap, right? And then once you hit the $7,400, you fall into this catastrophic stage, okay? And then you pay 5% of that drug till December 31st. Some people will be out of pocket $6,000, $7,000, okay? As next year, starting in 2025, the max out of pocket, $2,000. Okay, so if you know somebody out there with that plan that's $3.50 or $5.70, you think that plan is going to be $3.50 next year? No, it might be 10 times more than that. We don't know yet, speculation, but the people I know think that might be the route it's going. Do you think your copays on those Medicare Advantage plans are going to be the way they are today? Probably not. You think they're going to take away some benefits? Well, probably so. Okay, I can't talk about 2024 benefits, but I went to a meeting yesterday. We got this annual notice of changes, and it did not look as good as last year's. Okay, so they're already preparing. Some carriers are not preparing, and they're lowering their benefits so they can get what? Market share. Okay, some of the big carriers are saying, "No, we're gonna bump it a little bit this year, so we can bump a little bit to next year, so we don't bump a lot next year." Okay, trying to offset those costs for those folks. So remember that. All right, next question. What are the best resources for identifying gaps in coverage, Medicare coverage? Why the need for additional coverage? Well, original Medicare only covers a certain amount. They were never meant to cover everything, right? So original Medicare covers about 80%. You pay 20% if that's all you have. There's no maximum out of pocket for Medicare. So if you have $1 million claim and you only have Medicare A and B, you're out $200,000, okay? No prescription drug plans and no ancillary benefits. That's the dental, vision, hearing, and all that stuff. So on the left side there, we got to do what? You got to have Medicare A and B first, correct? The second one is a Medicare supplement. Okay, if you're an advisor and you're advising people to buy a supplement, which isn't a bad idea, you should say, all I know is I went to this thing and some guy said Plan G, as in Gary. Okay, told me Plan G. I don't know anything else about that, but he says if I say G, I'm pretty safe. You're pretty safe if you are, because it's a better plan you can, probably the most popular plan you can buy, because all you have is a $226 deductible, then everything's covered 100% for all your A and B services. You go see any doctor, any hospital in the whole United States, as long as they take Medicare. Okay, MD Anderson, right? St. John's Hopkins, Mayo Clinic. You want to go there? You can with the original Medicare. Okay, but it doesn't include prescription drugs. Doesn't include dental. Doesn't include hearing. But you can buy a separate Part D plan. And then you can buy a separate dental plan, a vision plan, a hearing plan, all those other plans, okay? Or you go with the Medicare Part C, which is a Medicare Advantage plan, which is an HMO or PPO or HMO POS. You know what that stands for now. And it includes everything. Now, these plans, there's companies out there that have zero premium. I think 90% of the plans out there have zero premium, okay? $0 doctor copay, $10 specialist copay. A lot of the HMOs are getting rid of referrals, okay, which is kind of nice. Some carriers have a national network, may not cover those big hospitals, but still a national network, which is nice, okay, and includes dental, vision, hearing. Let's say the dental is anywhere from $1,000 to $4,000. $4,000. The first $4,000 is covered. What do you get for your crown? 50% off, right? When you get on Medicare, first $4,000 is out of their pocket. Pretty good. A lot of people are like, I like that plan. How much is the premium? $0. How much is my supplement? $150. How much is my prescription? $5 to $50. Wow, I'm saving $200 a month, $2,400 a year. I don't really go. I could save a lot of money if I go with what? An Advantage plan. And vision, I get $250 in glasses. I get ride to and from the doctor's office. I get $100 worth of over-the-counter medicine. You get this U card. It's really cool. You go to King Soopers, you scan the little QR code or the little thing. It says, oh yeah, put it in my basket, it's covered. First $100, right? You can buy all this stuff. It's pretty cool, pretty neat. So those are the Medicare Advantage plans. Okay, more popular today than they ever have been. When I started selling Medicare Advantage plans in 2008, they've only been around since 1997. And they only allowed brokers like myself to start selling in 2008. I rarely sold them because they were $6,700 out of pockets. No dental, no vision, no hearing, $20 copay, $50 specials. Now it's 0, 0, 10, and 2,000, 4,000 in dental. Which one you want, right? Thinking about it. You have choices. All right, Medicare supplement plans offered by private insurance companies. The plan you should know is what plan? Gary, all right, I like it. Must be enrolled in Part A and B. You got to reside in the state that you're in, okay? You can't say, I want that Florida plan because it's cheaper, okay? No, just because you have a house in Florida doesn't mean you can have that plan in Florida. Whatever you're paying taxes is, that's the plan you have to buy from, the state you have to buy from, okay? Under 65, people with certain disabilities go on Medicare. They're available in some states, not all states. Wyoming does not offer Medicare supplement plans for under 65, okay? That's just one company or state, because I have family that lives there, so I know that answer. Pros, excellent coverage, provides, G covers you out of the country, certain a little bit of coverage, no referrals, no prior authorizations, no pre-approvals. So what's that mean? That means you can go pretty much anywhere you want to go as long as they'll take you and Medicare will pay. Okay, that's the freedom. Large networks, all the hospitals take Medicare. Cons, high premiums that continue to go up every year. If you're selling supplements or you're saying go with the supplement and you're planning for that guy's future, that person's future, 10% every year increase. Just plan it, put it in the plan. You planners, put in the plan, 10%. Did I say 5? No, 10. If they got 5, are we happy? Yes. Still plan for 10, okay? Because the next year it might be 11. Who knows? All right, and then no ancillary benefits, of course, dental, vision, hearing. If you miss underwriting, this is a question that we're going to have. If you miss underwriting, or let's say I started with the Medicare Advantage, so I'm just going to that question right now. You start with the Medicare Advantage plan and you want better coverage and you want a supplement. What happens? Can I have it? Maybe. Why maybe? Well, depends. What do you mean it depends? Well, first of all, if I started with a Medicare Advantage plan and my Medicare A, B, and C effective dates were all the same, September 1. Then I have till September 1 next year to buy a supplement, guarantee issue, because it's called a trial period. If my A was August 1st, my B was September 1st, and my C was September 1st, do I have that? No, I don't have that ability. So what do I tell that guy? Buy a supplement today, September 1st. Let's put you on a Medicare Advantage plan in January, and now you get your 12-month trial period. Okay? Now you get January to January. That's how you get out of that. If I waited a year and a half, can I buy a supplement guarantee issue? No, you'll answer full health questions. You could be denied, asked to pay extra premiums, and you may not. You may want that coverage. So we just want to make sure people understand that. As long as they understand that, then I feel comfortable selling Medicare Advantage plans all day. Okay? All right. Medicare Part C, Medicare Advantage plans, single plan. We talked about those carriers. If you have a Medicare and U book, it tells you all the plans, companies in the back of the book. I think there's 34 different plans available in the Denver metro area. So I would have them go there. Okay. Pros and cons. Let's see. Economic plans, 0 premium, provides a maximum out of pocket. Remember that $6,700 in 2008? Today they're $3,500. Okay. It includes Part D, includes all those extra benefits we talked about. The cons, networks, referrals, prior authorizations, and pre-approvals. Okay. So that could be an issue if you needed to get care when somebody says you need to go to MD Anderson. You're going to call me and I'm going to say, you know what you need to do? You need to move to Houston. Now, I've had that happen. Somebody moved, they changed your address. Why are you going to be down? You're going to be down there anyways, right? You're going to be renting something? Go down there and change your address. Call me. I'm licensed in Texas. I'll sell you a Medicare supplement plan G guarantee issue, and now you can go see that doctor. There's ways around it. If you haven't died yet, don't die on us. Because you're my client. You know what happens when people die? I was kidding. That was money thing. So, it's commission. You know, it's commissions. That was horrible. It was horrible, Alan. Okay, who pays for what claims between below and Medicare? All right, so we kind of talked about this, but we talked about the employer health plans, correct? So more than 20 employees, the employer plan pays first. Yeah, that should be employer, sorry. Less than 20 employees, Medicare pays first. TRICARE, Medicare pays first, TRICARE pays second. And federal employee plans, Medicare pays first, plan, and then the federal employee plan plays second. So that means you have to have Medicare A and B. You have to have A and B for those options, okay? All right. This is a question that I kind of got in a fishbowl, and it was a question that I had to look up several times. And it was discussed back in 2021 and recently here. And so what I ended up doing was looking up, first of all, I went to Google, right? It came up with CNN, it came up with MSNBC, came up with Fox. Then I went to, what's that, Chat GPT, and it gave me a sweet little awesome scenario. I didn't want to put it on here because do I know what's going to happen in 2034? Probably not. Do I want to advise you on that? No. So guess what? You stumped me, okay? I'm not going to get in the weeds on that one. Make sense? What might happen? You think taxes might go up? I think taxes might go up too, okay? Real quick, the bottom one, is there any political will or legislation to lower the Medicare age to 60? Well, they talked about it in 2021, right? Okay. I know the Democrats did. That's all I could find in here, of course. $730 trillion to do something like that. So I don't know if they're going to do that, but I'll tell you, let me tell you what the number was. Okay. And what was it per year? Well, some say 3.5 trillion, some say 1.8 trillion, 3.9 million additional insureds. So who's paying for those guys? What's going to happen to your Medicare taxes? Didn't they just double it 3, 4, or 5 years ago? It might go up. Okay. I hope that doesn't happen. So anyways, and it'd be crazy if they just changed that right away. Oh yeah, now we'll go help 3 million people. I don't think we can handle that as Medicare insurance agents. Hold harmless rules. Does anybody know what hold harmless is? Okay, so if somebody is on Social Security, collecting Social Security right now, and let's say they had some bad years, let's go back 5, 6 years when they got no cost of living adjustment, right? So my Medicare premium is $99. I did not get a Medicare, I did not get a cost of living adjustment, but the Medicare premium went to 105. Is that fair to not give them a cost of living adjustment and raise their Part B? Or no? So hold harmless agreement says you're fine. You could continue to pay $99 for this next year. If you're on Medicare and you're not taking Social Security, you get to pay $105. Okay? Makes sense? It happened. And then the next year, what happened? No cost of living adjustment again, 2 years in a row. So now we got 99, 105, and 114. So there was 3 of them. Okay? Then what happened? Big cost of living adjustment. Woohoo! And it went to $119 or something like that. And it was just enough to cover the Part B premium. Okay? Did they really get a cost of living adjustment? No. All right? Since then, they've had cost of living adjustments. So when it comes to hold harmless agreements or hold harmless rules, that's how it works. So if we have a no cost of living adjustment, those people that are on a SSA account or have SSA coming to their house will not have an increased premium. If they're not taking Social Security, they will be increased. Sound good? Okay. I know I'm about running out of time because I like to talk. Okay, sorry. I think it started late anyways. So I got like soccer, I fell down, I'm crying, something happened. All right, good. Just want to make sure. All right. I want the extra minutes here with the ticker coming. All right. What are the best plans for providing individual insurance for early retirees that are not disabled? Well, Cobra. So is Cobra cheap? No. Okay. Or you can go to Colorado State Marketplace. Is that place cheap? Which one's cheaper? So it depends. I wanted to hear it depends. Nobody said depends, right? It really depends because if I don't have a job, I can go on the marketplace and I can go do what? Apply for a subsidy, right? Oh, they're going to take $600 off my account. They're going to lower my deductible, lower my out of pocket. Great, winner. That guy, that person, that gal, whoever it is, has some money, still making money, doesn't have that option, doesn't have Cobra or has Cobra option, and is not going to get a subsidy. I'm going to pick Cobra all day long. Why? Because the price is about the same, but your Cobra plan is a much better plan. Do you know in Colorado, under 65, Colorado State Marketplace, they don't have a PPO plan? Not since 2020. They have HMOs and HMO POS, and you know what that stands for, right? Right. And I really mean that. That's what it stands for on that one. Yay. Okay. So I wouldn't recommend, it just depends on your situation. Okay. I get people calling me all the time. I have one of my agents that's the specialist with the Colorado Marketplace. So if they call me, some people, I get some referrals from this room. Thank you for the referrals. Thank you. Thank you. Thank you. I don't do this for free and for fun, but I really appreciate it if you do get I get referrals. So I'll say, call Jeff Stearman. He's the man at this. Now, do I know how to do it? Yes. Will I start them? Yes. And then I'll say, call Jeff. Jeff's the man, right? He's one of my agents. He's great. He knows what he's doing. Okay. Or there's something called share programs. You know what a share program is? Okay. What is it? There's these Christian share programs, one share. You can go buy a share program. It's not insurance. So we call them. I've called them before just to mess around. I had nothing better to do. And I said, what's the out of pocket? No, there's no out of pocket. What's the deductible? There's not a deductible. There might be a deductible, but we can't use the word deductible. It's a share. We're going to share it with our people, right? So they come together as a group. They use PHCS, private healthcare system, PPO plan, network of doctors, be good, large network. But if you go there and say, okay, well, I'm a smoker. I get lung cancer. Am I covered? No. Okay. Oh, there's one share program. How many people like to mountain bike? Anybody mountain bike? Any skiers in here? Anybody like to ski in the mountains? Are you covered on a share program? No. Okay. I like dirt biking. I'm not covered for sure. So be aware of what you're sharing. I've heard horrible stories. Some of my agents sell that stuff. I don't. I tell them, listen, I can't do it to them. I just can't do it. I can't live with myself. I won't do it, but I'll let you guys do it. Okay. Good luck. Good luck. So there's, like I said, there's no PPO plans, and just beware. And I wouldn't advise on that. I would give it to somebody that does know what they're talking about. Okay. Medicare options and resources for the chronic illness, dementia, and other common medical issues. Well, since 2019, Medicare Advantage plans have offered extra health-related benefits for over-the-counter medications, in-home support to help these people with chronic conditions, like transportation on those Medicare Advantage plans, right? They even have special needs plans. You have a chronic condition, diabetes, we have a diabetes special needs plan, okay? Heart problems, we have the plan for that. They're brand new. They're came about like 2 years ago, okay? So they're still in the process. So if you have 2 or more serious chronic conditions, that's when you can start getting some options as far as Medicare goes. Medicare supplement plans are better for these types of issues. Okay, why? Because it generally covers all that stuff and you don't have to worry about it, okay? Learning objectives, medical power of attorney is required for family members to manage Medicare on patients' behalf. Medicare and most health insurance, including Medicare supplement or Medigap plans, same plan, don't pay for long-term care, okay? This type of care is also called custodial care or long-term care services and supports. Includes medical and non-medical care for people who have chronic illnesses or disability. You want to purchase a separate LTC or long-term care policy. Now, can I buy one of those when I'm sick? No. I would start applying for that when? What age? 30. Good idea. Why? Because what's the cost like? Lower. If I'm 50, you might have some health questions or concerns. They call you and say, hey, I want you to remember these words, cat, dog, yellow. And then at the end of the phone interview, they said, well, what were those 3 words? I don't know. Declined. Not kidding you. That's why I don't sell long-term care anymore. But I have a great guy. His name's Ed Sutterfield. He sells that stuff. That's who I send it to. And I trust him to take care of them. Okay. It was just over my head. I decided to focus on Medicare and health insurance and get out of that racket. Because I tell you what, I'd spend hours and hours and hours at your house and find a great plan for you, and it gets denied because you couldn't remember yellow, cat, dog. And I didn't even do it right. I think it was cat, dog, yellow. Didn't I? I messed it up. Jeez. I declined. I'm declined. All right. Any other questions over there in the chat? So Medicare savings accounts are basically coverages when they talk about Medicare, Medicaid, low income subsidy. Okay. Hopefully those aren't your clients, right? But when it comes to Medicare savings accounts, if I had, say, my grandma who lost grandpa, and he was a breadwinner, and now she doesn't make as much money, and she was a housewife for 6 daughters, my mom and aunts. Poor guy. Poor guy, grandpa. Anyway, on a farm too. Anyway, so doesn't make as much money. So there's LIS requirements. I didn't put it on here. It wasn't for you guys, but Medicaid, you got to make less than $1,000 a month, have less than $2,000 in the bank. I think if you're for a low income subsidy to get your Part B paid for, or to get your prescriptions covered, okay, and Part D covered, or paid at $1 copay versus $10 copay, you would have to qualify. You'd have to have less than, have it in my book, you have to make less than $17,000.63 or something, and have less than $14,000 in the bank. That includes IRAs, CDs, and so forth like that. So that's part of the Medicare savings program that would help assist those folks. Okay. Now, any other questions on there? Yes, sir. Generally on those, no. Okay. We're talking that they're going to go off your assets today. Okay. They may go back 90 days, right? Because they'll say, wait a minute, you just had a bunch of cash in there and you depleted it all. The 5-year look back, this is 90 days for Medicare, generally speaking. Okay. And it can change anytime. Depends who you talk to, of course. But in that aspect, that's how it's going to work. Okay. Now I have some additional resources here, but that's not the best resource. Here's your best resource. Okay. That handsome man with very little gray hair. I don't know who he is, but man, is he handsome. I'm kidding. So, I want to thank you guys and gals for listening to me. I know it was boring. Okay. But I'm available. I appreciate this sponsoring you guys and being a partner for the FPA. I've worked with several financial planners from years before that, and found out my friend was a national, like Leslie, for the state. And I said, hey, I need to talk to you. She's like, no, you need to talk to Leslie. So I really feel like it's a great fit for me and you, because I don't sell financial plans, right? Best part is I'm not going to try to steal your portfolio. How many Medicare agents or how many financial planners out there selling Medicare? Some. There's a lot. Don't be surprised when that guy calls and then your portfolio is gone because you didn't sell Medicare, or you didn't refer it to the right person, or you didn't have anybody's, oh yeah, you just go find a Medicare guy. Or find somebody like me that might say, hey, that guy might not steal my portfolio. Might not steal your life insurance either. If they talk about life insurance, I'm like, where's the referral from? I'm gonna call you if you sell life insurance and say, take the life insurance. Does that make sense? So thanks, guys. I appreciate you. Sorry I went over. Have a good day.
All right. I think we're all very happy that we know the proper terminology of what is and is not a POS plan. So we will take a short break. When we come back, we'll have our door prize drawings and our last keynote speaker. So I think we'll start right around 3:25-ish.
Yeah. Yeah. Thanks, Craig. Perfect. You might need a card. I saw that you managed it.
Oh, he's fine. His clicker is that his clicker?
Yeah, the clicker belongs
To Dan. Okay.